people have to be better prepared for outbreaks. So we train and do workshops of veterinary services for them to be better prepared to outbreaks. So it's a preparedness phase of the work of the center to avoid those outbreaks and the crisis. And this preparedness plan is, if you go on Google and you type Good Emergency Management Practice, GEMP, FAO, you'll see the document that we are using to give the workshop for preparedness planning of the vet services. So we were creating in 2006 within FAO, between OIE and FAO. 2006 is a big date. It's when H5N1 was a big, scary thing for the international world in terms of risk perception. You have lots of donors, Europe, the US, they were really scared of a pandemic threat of H5N1, and they really needed an emergency response tool, and they decided to create CMCH, so we were created in 2006. Since 2006, we had 80 missions in 43 countries. We drifted away from responding to HPI outbreaks. There was a lot of our work at the beginning. We went to other zoonotic diseases such as Rift Valley fever, and also just other production diseases such as foot and mouth disease, for example, for the vets that are with us. And so we have a huge area of work, and we're not specialized in one specific disease, so it's really a response unit. That's the area of the world we covered since inception, from October 2006 to March 2016, and you'll see that the list of diseases cover a lot. We have rabies, we have Rift Valley fever, we had quite a lot of Rift Valley fever, outbreak investigation in Mauritania and in Eastern Africa. We work a lot on H1N1. We had a big joint mission with OIE and WHO when H1N1 was first identified, but then we work also on FMD, peste des petits ruminants, and other diseases, Newcastle, etc. So we have a wide area of work, and basically we work on what is of interest of the vet services when things get crazy, when they have a hard time to deal with the disease. We go in country and we help them. 2015 was a big year because there was a big turn around of H5N1, and that's from the CMCH work. As you can tell, we just had one mission on African swine fever in Ivory Coast, but all of the missions of CMCH from last year was H5N1. And how many of you did hear about H5N1 in Western Africa? None of you, huh? That's quite interesting because in 2006, we were all aware of H5N1 in the world. And I think that's something quite interesting when you see the shift in risk perception and impact of H5N1, and it has its impact on funding opportunities for countries. I will show you a good example of mission of H5N1 where we found funds to implement programs after. But that's, I think, one of the only example of 2015. In most of those countries where we had missions, we didn't find fundings. It's not interesting for donors to fund for H5N1 anymore. I think the sexy words now are Ebola or MERS coronavirus, and H5N1 is not anymore of such a big interest. So I think it's quite interesting to see the change of impact of a same disease, which still causes lots of losses, and that's still scary in terms of recombination possibility, and see that basically the world is not so much interested into it anymore. So we had lots of missions, as you can see, in Western Africa. Some of them were response missions. Those countries had outbreaks, and some of them were just preparedness missions. So we went into the country. We looked into the vet services infrastructures, the legislation, contingency plans, lab capacity, and we looked into their ability to control any introduction of the virus from neighboring countries. That's also part of the work from CMCH. We had two big missions also in West Bank and Gaza last year in unsafe, let's say, type atmosphere. You know, you can understand why Gaza is not an easy place to work. West Africa, really quickly in 2015, Nigeria showed the first cases at the end of December 2014, developed into a huge outbreak, and you can understand with the political issue in Nigeria, it's really hard to get good reporting of H5N1 outbreaks in the northern area controlled by Boko Haram, so it's really hard also for controlling such infection in those countries. Benin and Togo, we had two missions. They were preparedness. It's quite odd that Benin and Togo was and are remain still up to date unaffected by H5N1, being so close to Ghana that was infected, and Nigeria that was really heavily infected. Reporting and surveillance can be an easy part of being able to report disease or also find disease. This morning with the master student, we talk about commercial without, versus backyard poultry. In those countries, you have a huge backyard number of backyard farms, and that can really have an impact on surveillance and finding the disease. We had a mission in Côte d'Ivoire that was quite interesting because we sent the mission for preparedness, and while the mission was in Côte d'Ivoire, they had the first report of H5N1 occurring in the middle of the country. So the mission switched from preparedness to response. That was quite interesting. And we also had a mission in Mali, preparedness, and Burkina Faso. Mali was really afraid of getting the disease, both from Côte d'Ivoire and Burkina Faso. So that was also a preparedness mission. What we do is, like, at times we do emergency risk assessment. Also, when we do a mission, we don't only give recommendation, but we try to be practical to the country. You have a huge lack, and I think this afternoon we had discussion also about the importance of assessment in country. Emergency risk assessment for Benin and Togo was really important because we shifted the risk perception of the vet services into something they could use in terms of surveillance. They basically thought the entire country was at risk, and they wanted to give surveillance and do surveillance in the entire country. We shifted to areas where you have a high risk of introduction. So focus of resources in order to have a cost-effective answer to any risk of introduction. So what happens when we have a mission? We have, and I'm going to talk about the mission in Gaza Strip. In July 2016, we got a request from the Palestinian authorities that they had a lot of outbreaks in the Gaza Strip. So they had an uncontrolled situation in the Gaza Strip where they had lots of outbreaks, uncontrolled outbreaks. So at the end of July, we get a formal request from the country coming to FAO. We discussed with OIE to see if the mission could be of interest for OIE, since we are a joint mission. We get the green light from FAO. We get the green light for OIE, and at the beginning of August, we're already on the field doing investigations. So that was quite interesting because we had discussion with farmers, with affected farmers, and with the authorities. The interest of such mission also is the ability to have a meeting with the Israeli vet services, the Gaza vet services, and the West Bank vet services all together in one room. And you can understand that it's quite interesting in terms of technical people being able to discuss in areas where it's quite driven by war and some of these issues. This is the epidemiology of the disease. You can see that it's everywhere, basically in the Gaza Strip. It's just a disease that is found everywhere. The regional epidemiology we had, of course, that was presented, I think, this morning, that it's quite endemic in Egypt. Israel had cases in January and May. Following the January cases of Israel, we had cases in West Bank until March. In Gaza, when we had the first mission in West Bank, we heard that poultry was dying, but people were saying that it was Newcastle, and the lab capacity was not able to identify the real cause of the disease, so they get stuck on Newcastle. And I think actually the first outbreaks of H5N1 were already starting in January, also in Gaza, but that was not identified as such and reported. All of the influenza viruses in the region were quite similar, and we think that, of course, there is an epi link to the animal. Mostly backyard, and you have mostly signs in chicken, in poultry, as usual, and we had links with movements or imports of ducks in Gaza Strip before the first outbreaks of H5N1. As you may know, ducks can be silent carrier of H5N1, so that was quite an issue in Gaza. The Gaza authority decided to count all of the ducks following the first outbreaks of H5N1 just to stop the silent carrier of the virus. We got risk factor identified. That's part of the what you do when you go on mission for CMCH. You do an investigation. So you basically look into the risk factors, an open system, no biosecurity, so the virus is just spreading freely. You have no stop to the virus in the ground. You have the effect of ducks as silent carrier. You also have the vicinity of countries that were affected before, endemicity in Egypt, that could be your source of the virus, but also cases in Israel and West Bank with a quite similar virus at the same period of the year. And of course, you have white bird movements, but I don't think that's a big issue in the region. I think trade is the main issue when we talk about H5N1 exposure and spreading. We talked about risk communication, because it's really important to understand what people understand of the disease, because you go and talk to farmers, and maybe farmers have no clue about H5N1, they don't care, so you have to understand with their own words what H5N1 means. Because if you want to talk about the disease, you have also make sure that they will understand what you're talking about. So if that's something they have no clue about, you might be able to talk about ducks, poultry, and exposure, sensitivity, spreading, and they will have no clue. They will have no clue in terms of controlling, in terms of biosecurity. So one of the first steps when you do a mission and you talk to people and you understand, you try to understand what is the language on the disease, what they understood of the disease before getting into giving advice. So that's basically what we did. That's a picture that was taken in one of the affected farms, and we were basically talking about biosecurity, what they could do to keep control of the disease in the farm. You may understand that people in Gaza feel quite without control. So they get this disease, they get the war, so they think that whatever they're going to try to do, it's useless. So they won't be able, so you have also a huge socio-economic impact in these missions to bring those people back into controlling, to make them understand that they can control what's going on. Because if not, they won't do anything, and they won't be able to do anything about the disease. There is no surveillance taking place, and actually what we found is that the vet services were doing a great job, but they had no money to do surveillance. So basically they were going in farms, affected farms, and they had the ability to do a surveillance of 500 meters, which is basically nothing, over an infected farm. So they were missing the virus circulating from one infected farm to others, and they were just running after the virus being spread between farms. Passive surveillance remains, and you know, it's still on farmers' shoulders or vets, and you have to have a good knowledge of the disease. And people basically were seeing animals dying, but they had no clue that H5N1 was in Gaza, so they were not relating the death of the poultry with a specific disease that was occurring in the Gaza Strip, so they had no clue to report. They didn't know how to do. And of course, compensation was not something high on the list, so that was quite hard. Risk mitigation, a big thing, and I think it's biosecurity. It was quite funny because we were talking with traders, and traders were saying, yes, we use these products every time we go on the farm, we clean the vehicles, we go in the farms safe and clean. We went to the farms, we asked the farmers what's happening, and basically the farmers were saying nothing. People just enter the farm. So they entered the farm and you see there is no food bath, there is nothing. The funny thing about the biosecurity apply is like the low risk of introduction was covered. Wild bird was covered. You had fences. The high risk of introduction through trade and movements of people in the farm was never covered, and that was basically the issue of introduction of the virus in some of those farms. That had quite a bad impact in terms of social, political impact in Gaza Strip. You had farmers that had 15 production sites, okay? And those farmers were paying people working on farms in a view of protecting or avoiding those people to go and to do some terrorist acts. So basically, you have also people in Gaza Strip paying and giving money with work to some people working there in terms of keeping peace, okay? Keeping them work. 15 of the sites were infected, which means that all of the workers of those farms were jobless. And jobless in such situation might lead to actions that might not be really peaceful. This is basically where the food was stored. You can see that people were just going around and bringing the virus in and out, nothing, so the virus was just circulating freely in the Gaza Strip, and you can see that nothing prevents the virus from coming in from anyone. So you have a lack of awareness, so it was really interesting to do risk communication and awareness raising in this setting because people forgot about H5N1, and I think that was quite interesting, the question I asked you. People forgot the same way we forgot about H5N1. That's a cycle that is not only affecting us, but it's also affecting people in countries where you have risk of introduction of the disease. You have a loss of capacity in terms of preventing and controlling this disease. So basically the recommendations was, it was an emergency in the Gaza Strip to try to prevent the circulation. It was already too late, to be honest with you. Circulation of the virus was already occurring, but then the following stage was to prevent it to become endemic. You don't want any country additional from Egypt in the region to become endemic to H5N1, especially with the link to Israel and the link to West Bank. So you would have an open door and open access to infectivity to other countries in the region, which would quite be an issue in the future. And you also have an increased issue in terms of human exposure. So you will have increased human exposure to the virus that can be deadly, and that's also one of the issues. Increased preparedness, we looked into the preparedness documents, contingency plan, needs for compensation on farmers. It's also part of the work. When you work on a mission for CMC, you do something that is not seen as something really interesting or sexy. You look into the regulation. Vet regulation is really important because vet regulation leads to action on the field. So if your vet regulation is not sustained in terms of policy, in terms of validation by the ministry, it leads to no action on the field. So you have to look into the legislation, how the legislation is translated into actions on the field to be able to give advice in terms of control and prevention. And they had no emergency budget funding, so they were pretty, they just looked into things and see things around, and they were trying to do the best with the lack of funding they could have. SOPs are really important, standard operation procedures. They are basically the translation of contingency plan into something that is applicable for people on the ground. So it's basically a cooking book. So basically the contingency plan is going to tell you need 6 eggs, you need flour, you need to cook for 180 degrees for 6 hours, and the SOP is going to tell you how to do all things together and apply that to be able to have a formal action on the ground. That's what is SOP. So I'm going to be quick on that. It was just another example of the absence of biosecurity. And basically, the recommendations of our CMC missions have to be practical. So we're using a practical action approach that has to be cost effective in an area that has been already affected by war and crisis. So you cannot go there and say, we're going to apply the same standards as the European Union. It would be ridiculous. It would be unapplicable. So you have to understand the geopolitical reality of the country and then to be practical. So basically what we did is like we created a program to increase the biosecurity levels of those farms. And we know that it's not going to be applied at 100%, but the goal is not to be applied at 100%. The goal is to reduce the risk, so to do risk mitigations to a level that would decrease the viral transmission. So it's not to be perfect, it's to decrease the probability of transmission of the virus. And what we did is like also do a fine-tuning of biosecurity messages using communication, risk communication with farmers. So basically do the biosecurity, go back, assess what the people understood from the biosecurity, and then adapt the message that we gave on biosecurity to make it more applicable in the country. So it's a live project, well, it's a live recommendation. So it's not a set for once recommendation. And we go for a more effective emergency response. So we had, that was the recommendation basically we gave, more human resources, try to find funding, and we are implementing right now the project in Gaza and West Bank, training of public and private veterinarians. So it's an awareness project also. And then more materials and consumable, and still work on the contingency plan and application of vet legislation on the field. It's a humanitarian and animal health crisis because you have high mortalities of poultry. The disease control operation takes a lot of time in a low facility, low capacity environment. They have to wait for 2 months before restocking, which is huge. And in such an area, you can imagine that husbandry of cow can be problematic. And basically, poultry is an easy protein access for this country. It doesn't cost much to start your husbandry, your production of poultry. It doesn't cost much. And you get protein really quickly, really affordable. So it's also a food security issue in Gaza Strip in terms of feeding people living in this area. And I talked already about the risk of endemicity in terms of regional threats and human exposure, so it's something really important. That's the people that we saw on the field, so it's basically a multi-cultural environment. It's quite challenging to work in terms of response and preparedness mission, in terms of CMCH. The follow-up on this mission is basically implementation of the program right now. So we are in the phase of implementing a biosecurity awareness campaign in Gaza and West Bank, and we'll be starting a second phase of project in terms of contingency plan to have. They have a contingency plan, but it's useless. In most countries are happy to show you the legislation and what they did with the legislation, but it's not applied on the ground, so it's, you can throw that away. So we have a project starting soon in terms of going in time and talk to people on the field, getting information from what they did in terms of culling, in terms of digging holes in the ground to bury the dead carcasses, and translate that into something that they can use in the future. So we are in the phase of using the expertise that they built in country to make it more sustainable in the future if they were to have more outbreaks in the country. Thank you very much. It was fast. No.